Hello guys, welcome to my YouTube channel. Today we will talk about the basic introduction of anesthesia. Anesthesia is divided into two types, general and regional anesthesia. First we will talk about the general anesthesia. The general anesthesia will be divided into the 5 components, and let's talk about the component. Okay, so the basic important components are the loss of consciousness. Okay, second point is the loss of reflex response, means response are loss. And third is the amnesia. Amnesia means loss of memory. Okay, and fourth is the muscle relaxation, and fifth is analgesia. Analgesia means loss of pain reception. Okay, those. So these are the basic 5 components of the general anesthesia. Okay, let's talk about the which drugs provided these type of components. So the first of the 3, loss of consciousness, reflex response, and the amnesia, are provided by the inhalational or intravenous anesthetic agents, and the muscle relaxant. So friends, the muscle relaxation is provided by the neuromuscular blocker agents are used. Okay friends. And the last one, analgesia. Analgesia means the loss of pain is provided by opioids. So these are the basic 5 components, and the drugs provided these components. Now point to remember is that the neuromuscular blocker agents never produce loss of consciousness. We have to remember these. The neuromuscular never produce loss of consciousness. They cause only muscle relaxant. Okay, so things we have to remember: never produce and causes only muscle relaxation. Okay friends. Now the second point we have to remember is that whenever neuromuscular blocker agents are used, ventilator from outside is required. And this is the we have to must remember this friends, because ventilation is required. Now we talk about the steps of the general anesthesia. What are the steps we perform to do the general anesthesia? First thing, we attach the mandatory monitors. So what are the basic monitors? We have to just tell the ECG, the pulse oximeter, the temperature probe, which is very important, the blood pressure curve. The blood pressure we generally use to monitor the BP, and the capnometer. The capnometer is a device used to measure the CO2 level in the blood. Okay, so these are the basic monitors we have to attach. Now the second is the securement of the intravenous cannula. So drug, in case of emergency, if we have a secured IV cannula, then we have to just give the drugs. Now third is the induction. So induction, it means loss of consciousness, that is the patient has to made unconscious. Okay, so 2 ways of induction are there. First of all, the IV anesthetic agent, means intravenous induction of anesthetic agent into the patient. Second is the inhalational anesthetic agent. So we will further view for the inhalation and the IV drugs in the subsequent videos. And fourth is the bag and mask ventilation. Fifth is the intravascular neuromuscular blocker agents. Okay, and sixth is the laryngoscope and intubation. So this is a very important point. Seventh is the maintenance of anesthesia. After induction, we have to maintain a dose for the anesthesia, and this can be performed by the continuational inhalational method and continuous IV method. So here we have to note the TIVA. TIVA means the total intravenous anesthesia. So when both induction as well as the maintenance IV anesthetic agents are used, it is known as TIVA, total intravenous anesthesia. So just remember this TIVA. It is a very common topic asked during the examination. And eighth is the reversal of anesthesia. Reversal of anesthesia means keep the patient unconscious to consciousness. Okay friends. So the basic components of the general anesthesia are divided into the 3 basic steps. Okay, the first one, the base of the basic steps, is the induction of the general anesthesia. Second is the maintenance of the anesthesia, and third is the reversal of the effect of general anesthesia. Now let's talk about the regional anesthesia. Okay, regional anesthesia is anesthesia used by the providing effect by local anesthetic agents. Local anesthetic agent is deposited locally near the nerve fiber to be blocked. It is to be remembered by heart friends that the local anesthetic agents are deposited locally near the nerve fiber to be blocked. And the effect, what are the effect this regional anesthesia cause? So friends, this drug causes all three autonomic, sensory and motor nerve outflow. So the division. So the regional anesthesia is further divided into the two parts. The first is the central neuraxial blockage and the second is the peripheral nerve blockage. Okay friends. So the what are the types of further central neuraxial anesthesia? The first is the spinal anesthesia and second is epidural anesthesia. And the from peripheral, brachial plexus nerve block, femoral nerve block and sciatic nerve block. Please subscribe my YouTube channel for further information. Thank you.